And we are live. Welcome back, everyone. Welcome to the Melanin Initiative. I'm Dr. Kimberly Madison, a doctorally prepared nurse practitioner, one of your co-hosts here at the Melanin Initiative podcast. In healthcare, there is often too much information and not enough time. Here at the Melanin Initiative, we avoid TMI by breaking things down into language you can understand, creating a safe space for you to ask your questions, and sharing our nursing perspective without taking up too much of your time. All month long, we'll be talking about breast cancer. October is Breast Cancer Awareness Month. Each of our guests will be sharing their relationship with breast cancer, so it'll be slightly different than our regular episodes, but we think you're going to get a lot of value out of them. We're so grateful for everyone who's agreed to come and talk to us and share their story. So often people think they're the only ones going through something, and that leads to suffering and silence. We know and hope through this show, you'll see that you are not alone, and there are a number of resources available to help you. We hope you'll be motivated to do what you can when it comes to your health, to establish a relationship with your primary care provider who can identify your risk factors and make you aware of the available options. But most importantly, we hope you'll understand the importance of early detection, which I cannot emphasize enough. The data shows that when Black and Brown communities, when it comes to cancer in particular, especially breast cancer, in Black and Brown communities, we often wait too late to be diagnosed. And at the time of diagnosis, it's often very advanced and the options are much more limited. And thus our risk for disease and disability and death are that much higher. We know knowledge is power, and so is having a support system and understanding the importance of advocacy. My goal is to address each of these themes throughout October. We'll be releasing a new episode every TMI Tuesday at 10 a.m. You can find us on all your favorite podcast apps and YouTube. So this is actually, by the time you see this, I think, so, I'm not exactly sure I'm going to upload these, but I think this will be the third in a series of at least 5 episodes. The first one, so this is my mother, Leona Madison. We've already filmed her. She is a breast cancer survivor. And in her first episode, we talked about her diagnosis phase. So I said that since, I'm really familiar with her story, I thought we would do it more justice by dedicating each episode to a particular phase in the journey. So if you haven't already, go back and watch the previous one on her diagnosis. Today, we're going to move ahead and talk about her treatment. And so in the first episode, we did find out that in 2011, 12, she was diagnosed with stage 1 breast cancer. She did get a second opinion on that. And so she was given the recommendation to proceed with surgery. And so I'll let you pick up from there.
Yes, so I received the surgery, which was in and out surgery, same day, lasted maybe about 3 or 4 hours.
What was the preparation leading up to surgery? So you find out you have to have surgery. What's going through your mind?
The needles. The needles was going through my mind. How many needles and stuff? And so they ensured me that I would be knocked out, so I wouldn't know how many needles. So after I got undressed, we got there early in the morning. I think the surgery was scheduled for about 7 o'clock.
Okay, so did you need to take off work for the surgery?
Oh, definitely.
How long was it going to be before the surgery? Like if it's Monday that you got the results, was it going to be a week later, another month later?
Well, after I completed my FMLA package for work to take off, it was recommended by my team that I take off for 6 months and just stop everything and let them do what they needed to do. And they guaranteed me if I stopped everything that I would have a good outcome. So after I filed my paperwork immediately after I left the team meeting, me and my husband was in the consultation room with the medical team, and immediately I filed my paperwork, and I was off for 6 months or more, because I had some very nice coworkers who had donated some leave because they like to work all the time, and I didn't have a problem taking it. And so after the surgery,
before the surgery,
the morning of the surgery.
So did you have to do blood work leading up to that?
Had to do a lot of blood work leading up to that. a lot of blood work. I remember that.
And they coordinated that for you.
Everything was coordinated. I didn't have to do anything. And
Mm.
then they confirmed that everything was in, and I was scheduled. And my oncologist, who just so happened to have 40 years of experience and from New York, and who also was a best friend of one of my professors at Howard, called me the night before just to make sure that I was okay. And he would to let me know that he would see me the next morning.
So besides the needles, what other thoughts were going through your head? Had you had a bunch of surgeries before? You already knew?
I had never had any surgery, only with having 2 children.
Okay, so did you have any questions about that at all, or you felt you were pretty prepared?
I felt I was pretty prepared, and I felt comfortable with the team that I believed that God had ordained. Actually, the surgeon, who we didn't even discuss, the surgeon was also the one that had also called me the night before, who was also scheduled to leave that particular facility. But he told me that he would stay and do the surgery and see the outcome.
And just so the audience knows, you do, were you using military benefits?
Yes. I was using military. That's why I left the first provider.
Oh, okay.
And so the military, yeah, I had all my health care done at the military.
And so that's what she means by that surgeon was preparing to leave because they were getting orders to go somewhere else, which is very, very common in military healthcare. So you can get accustomed to someone and then they're gone.
Yes.
So, okay, so now we're heading up to surgery. So what's that going to be like? The night before, you couldn't eat or drink? Did you have a ride arranged?
The night before, I couldn't eat after 12 o'clock. And my husband was going to take me, of course. And another dear friend was going to meet us there at the hospital. Okay. And so I don't remember, but I don't think I went to sleep that much because I was still concerned about the needles, and that was the only thing that was my major concern, was the needles.
And still no pain or other symptoms at that point?
No pain or anything. Had a good dinner. I think we went out and yeah.
And your appetite didn't change?
Appetite didn't change. I had a cup of coffee, of course.
Well, I mean, like this time in the journey, like with all the information coming at you?
No, appetite didn't change. It remained the same.
And how would you rate your health during this time? Good, fair, poor?
I would say my health was good. I had pretty much did everything I was supposed to do. Of course, being overweight wasn't good, but it wasn't like red flags or anything. I did everything annually, all my annual eye mammograms, GYN, and so I would say good.
And I guess, did you always stay on top of your health? Where did that come from?
Yes, I always stayed on top of my health because I felt that as a woman that it was important. And because of the services that I was getting from the military, I was always informed, at this age you have this, at this age you have that. And so, I always stayed on top of my health, except for the dentist. But, that's another story.
Okay. Okay, so now it's the night before surgery. You arrived to the hospital. What was that like?
Arrived to the hospital. Still, that was my first surgery outside of having you guys, and so it was a little scary. It was a little scary, and but knowing that I would wake up and see the next day, that was more positive. And so they took me in right away. I had to change, of course, and unchange, and my husband was there in the room, and then I had medication that was injected put me out.
Okay.
And then you count, like they say, count 1, 2, 3 or whatever. And apparently I went out.
And even though you're saying you had, prior to this, your experience was having us, but you actually didn't have a C-section. So you didn't have, you didn't have surgery. You had 2 vaginal births.
Yes.
Yeah.
Yes,
okay.
yes.
So this was really your first surgery. And weren't you calling it minor, major? I know we used to have like a little joke, and I was like, no, there is no minor.
Yeah, I was calling it minor. Yes, I said it's just a little minor.
And even then, you were only calling it BC, right? You still weren't really saying breast cancer.
Right. I was just calling it BC.
Do you want to talk about that at all?
Well, the only reason I just didn't want to continue to say breast cancer, I just said BC. You know, it's just something that some of my other ladies that I was supporting, we just would say, you know, BC.
Yeah, and I think for me that was since I was in nursing school at the time, I know it's important, and that's why your sister was concerned about the denial, which we talked about in the previous episode, because you weren't really saying it. You know, you had your own way, and I think also because of your faith, you weren't trying to name it and claim it. You know, I think that had a role to play too.
Right. Yeah, we probably did. Yes.
Yeah. I think it was a couple of years before you even said breast cancer. Yeah. So do you think yeah, so I don't want to jump ahead. So for me, initially the semester was wrapping up and I had booked a flight to be there for the surgery, and I think it was supposed to be like on a Thursday, but then they called you and said, oh, we can get you in on Tuesday.
Yes.
And I remember at the time, your whole thing was just getting this out your body, getting this foreign thing out your body.
Yes.
And so you were happy to go early.
Right.
And so I unfortunately did miss that surgery.
Right.
And so you had chosen to stay, I think, an extra night so that I could be home with you for your first night home.
Well, what happened was once I found out the surgery date and stuff, I had called my family and I had a calendar out and I told them this is the date I have to have this done, that done. And so that's when they just dropped everything and they were there to support me. And but your father was there for the surgery. And then my sister or Patrice, one of my nieces, I have awesome nieces. I believe it was Nikki. Oh, I said her name.
No, that's okay.
Oh, okay. I believe it was Nikki, the warrior in the family. She came shortly after I had surgery, like probably the next day or two.
Okay. And then I was going to say something about that. Okay, so you had your surgery, you wake up, you're in the hospital. How are you feeling? Any pain then?
Oh, wow.
Oh, and did you already tell us what kind of surgery you had?
No, I didn't. You didn't ask. I had a lumpectomy.
Oh, that's what I was going to say. So yeah, so your course of treatment started with surgery primarily because of the size of the tumor.
Yes.
So for some men and women, depending if it's quite large, they might actually start with chemo first to help get it smaller. So everybody's journey, when we say everybody's journey is different, that's one of the things that can be different is the order in which you receive surgery, chemo, or radiation, so that there's less to remove and it can be a shorter, smoother surgery with less complications. And so at this time, did they know if you were going to need a chemo or radiation, or they were waiting after the pathology resorts from the surgery?
The oncologist actually knew that I would need chemo.
Okay.
Yeah, he actually knew, and the radiologist oncologist.
Okay, so surgery's over. You didn't really have any pain. You went back home immediately?
I went back home the next day. And I could have went home that day, but for some reason, which I can't remember, we had to go back the next morning. So I just said, instead of commuting back and forth, just stay.
Okay, and like I said, I remember it was because I wasn't in town yet, and you wanted me to be home.
Okay.
Yeah. Okay, so now you're home. You're recovering from surgery. What does that look like?
Different, because now my whole life stopped. You know, my whole life had stopped and had to stop for 6 months. And so I'm like, what do I do? I didn't have any pain. I hadn't had the chemo yet, so I was able to move around to take care of myself. And I had a very good supportive church family and friends who did my shopping for things that I needed. Not that I felt that I needed them, but they was there and they wanted to help, so I just let them help. But my appetite still, because it's just surgery now, my appetite is still very good.
So we've kind of already hinted, but At what point did you find out that you were going to need radiation and chemo?
Right after the pathology report had reached the second provider.
And how did you feel about that?
Because where I was going to the military, they believe in the traditional method, so you don't come back. That's their hope. So I found out immediately. Before I went into the surgery, I already knew that I was going to need chemo.
And how did you feel about that?
I'm going to say for myself, I really didn't kind of know how I was going to feel about that. You know what I'm saying? Because for me, because I had already been with other people who have went through the process, I knew what it was going to do. It was going to take my hair. I was going to lose weight, and I did lose 25 pounds. I knew through another best friend who had went through the journey that what I was going the taste. Because when you're on chemo, everything tastes like aluminum.
Mm-hmm.
Your taste buds are gone. And she said, don't cook with metal instruments and eat with metal,
utensils.
Mm-hmm. So I went to the Dollar Day store and I brought everything was plastic, and so yeah.
Okay. And so you had to go through radiation. And what was that like? Didn't you have to first go in and get your marks?
Yes, you have to go in. So after you have to wait, I had to wait a certain amount of weeks before I finished the chemo.
After surgery, I think you waited 4 weeks.
4 weeks.
And then it was going to be chemo.
Chemo, at least 4 to 6 weeks, and it was going to be chemo. And then after the chemo, the 6 weeks or the 4th week, I had to go in there to get marks so that the radiologist, oncologist would know exactly what area to target.
And I know for your chemo, it was one session every 3 weeks, 21 days?
Every like 4 to 6 weeks.
And you only had to get 4.
I only had to get 4 of a low grade, but he did tell me that the last one was going to be like a cocktail.
Okay. Yeah, because some people, again, every journey is different. Some people get a lot more chemo more regularly. So that was also another good reflection of the fact that you got diagnosed so early. And then, okay, so for the chemo, which yours was going to be an infusion, which means it was going to be injected directly into your bloodstream.
Right.
You had to go get your port placed.
Yes.
Okay, so you want to tell us about that?
Okay, now.
And how did you find out about that?
Well, first of all, it's so much information when you're going through this process. That's why it's important to take someone with you. And so I didn't hear anything about, because at this time I went by myself. I didn't hear anything. I don't remember anything about this port, and that's not the only way that they can pull it, because they could have also injected it into my arm. But I didn't want my arm badgered and discolored. And so they explained about this port, but I didn't know that that was considered another procedure. So, but not having a choice, I had the port put in before I started the chemo. And that was where I got the chemo and all my blood work after that.
Okay, and so for the port, that was like a separate appointment.
Separate appointment, went in that day. I remember the nurse didn't know what side. She thought she was getting ready to put it on my right side, and I told her no, you have to put it on the left side, because my surgery was on the right side. And they had already told me that I don't have any needles, nothing injected into my arm, even to this day, on my right side.
Okay. And so for that Metaport, they made like a small incision. Were you awake?
No, was I awake? No, I was out.
Okay, so
yes, I was out.
And so they made a small incision, placed the port underneath the skin, and then every time you go get chemo, they put a needle through that port, and then that needle or catheter is connected to some tubing, which is connected to the chemo, which is a liquid in a bag.
Right, and I didn't like the port.
And weren't there rules about it?
there was rules. You can't sleep on that side. It felt like really something foreign. It felt like a battery, until my skin, I guess, adjusted to that area. So I had to sleep on my right side and not on my back. But other than that, and I already knew immediately that once that journey was over, I wanted it out.
Okay. And did you have to go in between chemo and get like heparin? Did you ever have to go in? Okay, you never had to do that. Okay.
Mm-mm.
Okay, so first you had your chemo, and what was that like?
And it's in an infusion room that was really nice and cold. The nurses was nice, TV, snacks, and my family was there. There was one family member that was there each time I went. So if I had four, there was four family members that was there. And the good part is that afterwards we went out and we ate dinner.
And one of those was on my birthday. I was there for that.
Yeah. You was there for the last one.
Yeah.
Yeah, you was there for the last one. And so and it was a lot. I mean, it was just to see so many young people that was there, and I chit chat with them, of course, to encourage them.
Oh, other patients.
Yeah.
Yeah. And didn't you have like the same nurse? You developed a really good relation with the nurses.
Yes, I had. Oh my God. I had the nurse that had followed me until this past April because I graduated out of the oncology department. And her name was Miss Kimberly too. And she knew my voice when I called for appointments or whatever. She would call me back and check on me and stuff like that. And so, yes. The oncologist, he was there, the social worker. So it was a really close-knit team.
I do apologize for the background noise, everyone. I'm at my parents' house. They're not used to filming, and so just bear with us. Okay, so during the chemo itself, did you bring something to do? Did you sleep through it?
Oh, no. Well, I had, like I said, I had one of y'all was there each time, but I think I had some crochet, reading, watching TV. And because I'm a people's person, I was always interacting with whoever was like next door.
And so after chemo, would you have any symptoms, weakness, fatigue, nausea, diarrhea?
No, definitely no diarrhea. A little fatigue on the last one. Like I said, he warned me beforehand that the last one was going to be a cocktail. But other than that, that's it. I didn't have anything else.
How was your energy level?
Energy level, I had to walk at least 30 minutes a day. And so that was important. So we walked, me and my family, we walked. And it's just when I felt like it kicked in, I just laid on the sofa, let it do its work, and watch whatever was on TV or relax.
And you were spending, Stoops was your walking buddy then, right?
Oh yeah, Cynthia Stoops.
She lost weight.
Yeah, she lost weight. She said, I done seen every side of you because she was there at a lot of appointments. She was there.
Oh yeah, she drove you and everything. She was cooking,
and everything.
She cut her hair too, right?
Cut her hair.
Yeah, she had locks too. Yeah.
Mm-hmm.
Okay, so that's chemo. Did you get extra colds or anything during that time?
No colds. Okay. No colds. No.
Did you see any changes to your skin or nails? Because your hair was already.
Oh, the nails. Yes, the nails. My nails did turn black. My nails and my toenails did turn black. And but like I said, I was educated that was going to happen. And because I had seen it with other women, I knew that was going to happen. And so, but soon after I finished the chemo, gradually my hair came back, and gradually my color to my nails and toenails was returned.
I remember you spent a lot of time on them too, painting them and just trying to keep them presentable.
Yeah, in New York, I gotta look right.
I think we always talk about the hair. People focus on the hair, but the nails.
Right,
that was like that one that lasted longer than the hair.
Yeah, because at that time with the hair, a lot of women, even if they didn't have cancer, they were cutting their hair. So a lot of women, even in my church, didn't even know that I was going through that journey, because they just figure, oh well, you're just another person that had cut your hair.
Yeah.
When I returned back to church, because I did for 6 months isolate myself from not only work, I stopped work, I also didn't go into large crowds, and but still had the support of the crowds, of those crowds.
And then how long after your last chemo did you have to wait till you did radiation?
Again, I believe it was 6 weeks.
Oh,
It
okay.
seemed like everything was 6 weeks, and the radiation was, I had to take radiation for 33 days from Monday to Friday. And what that entailed was to go back to my provider, get undressed, lay on the exam room and radiology, and my radiologist, oncologist, she would come and she would target that area. And she was great. I mean, we still keep in contact today.
And I remember, I mean, I think people always talk about the chemo, but I thought the radiation was more demanding because it was every day.
Yeah, that was definitely just every day, you know. It didn't last that long, about 20 or 30 minutes, but still just having to get up and go, you know, and I did that by myself, you know, because I didn't need anybody to take me back and forth to that.
And you were still in school, and I think you started going to work at some point.
I was still in school. I had promised the oncologist that if they had one chance, and I had to be back in school by the end of August. And he said that if I listened to everything he said, I would be sitting in the classroom in August. And so I went back to school. I didn't return right back to work because I still had more time, you know, on the books. But I did start school. The professors, everybody was, because I wasn't the only one. There was other women that was also in the classes that was going through the journey.
And did the radiation hurt either during or after?
I didn't have any problems with the radiation. My radiation oncologist, she had gave me a cream for that she said works good with African American skin for African American people for the skin, and I didn't have any problems burning or anything.
And that was to help with like discoloration or pain? Okay.
Yes, discoloration, because I didn't have any pain.
Okay, and so you first felt the lump in April. That's what I remember. Surgery in May, chemo from June to September. I think Nikki was at the last radiation, wasn't she? I mean, chemo.
No, I thought you was last.
I thought somebody came in September.
Clarence came, and Pat came.
And I thought Patrice came.
And Patrice came.
Yeah, okay. So that would be, I think it was 4, June, July, August. I think somebody came in September.
Well,
and then radiation went from all the rest of the year till December. Wasn't December the last?
I think Clarence came in September because by the time Clarence came, I had finished something.
Oh, okay.
Yeah.
And so then you finished radiation in December, right? At the end of the year? Okay. So that rounds up your story about your treatment phase. Okay, everyone. So just as a reminder, we're splitting up her story into different segments just so we can give each part of the journey its due diligence. So the next one will cover her health at that since then, and any side effects that she's had to deal with and how she's dealt with that. Let's see. Remember, I can't remember if I went over that in this episode. Remember, this show is for educational purposes only. The opinions expressed are our opinions alone. They are not a representation of any of our affiliations. If you're experiencing a medical emergency, you should seek medical attention and medical guidance from your healthcare provider. If you're having a physical emergency, you can call 911. And if you or someone you know is having a mental health emergency, you can call 988. As a recap, today we talked about my mother, Leona Madison's breast cancer journey, particularly the part of treatment. So surgery, radiation, and chemo. We learned a lot about having a support system, the importance of doing your own research, and that, again, the earlier you get diagnosed, the better the outcomes. Even the experience itself is much, much better. Thank you for sharing. Remember, you can email us your questions and show ideas at tmi.melanin@gmail.com. Subscribe to our YouTube channel and follow us on Instagram, TikTok, and Facebook Please share with your friends and even the people who aren't your friends. And rate us on Apple and Spotify. Leave comments and reviews. It really helps the show grow. It's how you can support us, and it gets the message out there to those who really need to hear it. You can find our social media links and any resources that we brought up in the show in the description box or show notes. Remember, we release a new episode every TMI Tuesday at 10 a.m. on all your favorite podcast apps and YouTube. October is being dedicated to breast cancer awareness, and then we resume with season 2 in November, where Alicia and Geraldine will be back, as well as our special guests, some old and some new. Thank you, Mommy.
You're welcome, daughter.
See you next time, everyone. Thank you for watching.